Hello, my name is Steve Estevez, and I'm coming to you from the 2023 annual AAD meeting. Joining me today is veteran dermatologist Dr. Marty Zaiac from Greater Miami Skin and Laser Center. Dr. Zaiac has been in the practice of medicine for over 30 years.
Correct.
He's expert cosmetic dermatologist. He's also a reputable Mohs surgeon. Thank you so much for joining us today.
No problem, my pleasure.
How has the landscape of dermatology evolved over the years in terms of the advancements of treatment, technology used today, and how you plan on implementing that into your practice?
I'm not sure I want to disclose this, Steve, but to be honest with you, this is my 37th year attending the Academy of Dermatology meeting. At first as a resident for 3 years, and then as an attending. And I would say that, for the last bunch of years, the biologics have dominated the medical dermatology.
See that a lot.
Initially for psoriasis and psoriatic arthritis. Now we have for atopic dermatitis, both injectable as well as oral medications. There's a lot of new in these JAK inhibitors, interleukin inhibitors, and tumor necrosis factor inhibitors that are out on the market. And it's a balance of what to use. They all have little specific things about them that make them maybe more acceptable for one patient versus another. So seeing that in person and hearing about it in the lectures certainly is quite supportive for us in practice.
Amazing. You were first starting to come to the annual meeting as a resident, but I feel like I'm seeing a lot of young faces. And I think it's more geared towards that, right? The residents coming in, first year practicing dermatologists. And
I think as a resident, you look forward to it because it's kind of like a party for 3 days, I don't want to say it as such, it's educational. There's 20 or 30 sessions going on almost all hours of the day. So if they take the opportunity to go see these sessions, they can certainly learn a lot. But, there's a lot of sponsored activities in the evening, and especially depending on what city you're at, they try to, incorporate the local culture into the program. And they for them, after 37 years, I'm over that phase. I come to meet colleagues, catch up with some old friends, learn a few new tips, and then go home comfortable. But as a resident, they're here. They have opportunities to meet potential practices where they want to,
That's a
join.
Good point. That's a very good
they
point.
do interviews for fellowships. They meet other colleagues.
Great recruiting opportunity.
It's a great recruiting opportunity. And nowadays, we have to think about that because the way the restrictions are coming down on us doctors, both from the pharmaceutical companies, but as well as the government as far as reimbursement and stuff like that, it's very tough to be in a solo practice,
We've seen that rise. There's a higher prevalence of Derm Groups out there, and certainly being at the annual meeting, you see a lot of derm care type groups in the facility, in the halls. How has it benefited patients at the end of the day that derm groups such as Derm Care come in and really support the physicians? And then the second question to that is, how do residents benefit from this new type of organizational thing that's happening in dermatology in the last couple of years?
So patients, I think, benefit for sure because my time is spent now on patient care. I don't have to worry about the administration aspects of it. I don't have to worry about handling my employees. They're still my employees. My practice stays the same. I joined Derm Care probably going on almost 6 years now. And if you walk into my office, no one could really tell the difference. It's my practice, but in the back of the scenes or the behind the scenes type thing, I have a very strong administrative team that handles all my billing, all my employee relationships, all my contracts with insurances. So for me, it's been very helpful because I can focus on what I like to do and not see patients. So in turn, that probably turns around that the patients getting better care. So I'm not caught up worrying about, how am I going to pay this bill or do that? So that's been great. And certainly during COVID times, it has been super helpful.
For sure. We saw many practices really struggle during that time. I mean, you couldn't have your doors open, and that's your main way of generating revenue.
And as a solo practice, I'm not seeing patients, and I have $30, $40, $50, $100,000 worth of monthly expenses. At least Derm Care had my back and really supported me.
Yeah, tough time.
I can tell you that it was probably the best business decision I made. The team at Derm Care, I trust them, especially the CEO, comes across, and everything he said has come to fruition, so I'm very pleased with that. As far as residents, I think it's a great opportunity because they get to see exposure to a lot of different things. I think that Derm Care now has practices in 3 different states.
3 different states?
Florida, Texas, and California. And depending on where these residents want to live, there's opportunities. There's doctors that are trying to get ready for their exit strategy, and they're looking for younger doctors to take their place. So at Derm Care, we have a lot of variation of different types of practices, more medical, more cosmetic, more surgical,
yep.
and they have a lot to offer.
That was a big change too for you, right? When you started off, it was either, hey, I'm going to open my own practice, or you probably partnered up with a veteran physician who's probably on, his way out, thinking about retiring and taking over their practice, and then I guess there was some sort of a partnership agreement there where you continued paying the.
Correct. You bought into a practice, or you joined the practice after a number of years of contributing.
You've seen I've seen a shift where residents now, hey, you can get better employment opportunities,
Correct.
Whereas you don't have to go into the risk of a solo practice and all the investment and everything.
The risk of a solo practice today is very difficult because all the obstacles that we have to overcome. First of all, building the infrastructure, all the equipment, getting on insurance plans, which is almost impossible in bigger cities that they're overflowed or they're not taking new candidates. And then the expense and the stress of it all. Obviously, when I started, I was making very little money because I was just seeing the patients I could see and not having a reputation. People would walk in and word of mouth, and little by little it builds, but it took a long time to get to that level. Nowadays, with these opportunities, residents graduating can go in with a very nice salary starting, and if they work hard, they can double, triple that salary, and they have an opportunity to become part of the group.
It's amazing. Well, I don't want to take too much of your time. I appreciate you answering some of our questions, and
anytime,
for being such an amazing mentor to young physicians coming out in the field.
It keeps you sharp, If I was by myself and not training these doctors, I would get into a routine. They come, they ask questions, we share articles. So it's a great interaction for both of us. I learn just as much as they do when we do these type things.
Perfect.
All right.
Well, thank you so much, and we'll see you at next year's AAD.
For sure, San Diego.